Well, really from the point that you hear those words, "You have cancer," your life changes. It just felt like the world stopped. As a cancer doctor, I'm used to helping people through the most difficult time of their lives. But I still wasn't prepared when it happened to me. I noticed a lump in my breast. So I, of course, took it seriously. And after watching things for a few weeks, like I might tell my patients to do to make sure that it's not going away, I went in and got it checked out. The result was a double mastectomy, chemotherapy, and reconstructive surgery. From my initial diagnosis, initial tests, treatment, and follow-up, every department at Gunderson has been so caring and professional. I was amazed at the outpouring of support. Friends, family, coworkers seemed to come out of the woodwork to help my entire family. One of my daughters said was, "I hate that you have cancer," when I was going through cancer. And now she's proud of me. We've done a lot of work in the community and raising breast cancer awareness. I was an honorary chairperson for Stepping Out in Pink, one of our big fundraising walks. And my kids have loved to see me do all of those things. And now that they see how healthy I am and things seem sort of back to normal at home, they are just so happy. So as a cancer doctor, I've always told patients and informed them about the benefits of mammograms and self-breast exams. And after having lived this story, it just enforces that message. And I think I'm even more passionate about getting that message out to my patients and to the community. I've tried to use my experience to help other people, help them know that I understand what they're going through, and that even though it seems tough, we're gonna get through it.
The thing that I'm working on right now is working with cancer survivors and finding out what kinds of needs they have after their treatment is over, how they can get back to their usual life.
I also try to show them how healthy I am now and how well I'm doing, and that will get them back to that place and maybe even better than they were before. One of the big things that going through cancer treatment gave me was the courage to do things that I never thought that I would do before cancer. A few months ago, I went to Nepal and I climbed 3 mountains there. That was something that I never would have done pre-cancer.
Another part of breast cancer care that I've been really involved in is prevention of breast cancer. And in this clinic, what we do is we try to find patients who may be at risk for breast cancer, either because they have a genetic problem or a family history, and we try to do everything we can to prevent them from getting breast cancer, whether that's early detection or medications to actually reduce the risk. You always look for silver linings in these things, and one of the silver linings is that my relationships with my family, my friends, my coworkers, my patients, everything I think has deepened and strengthened from this experience. I gained a deeper empathy for my patients and their situation. Now I literally have a complete understanding of what it means to have cancer. I think the most important thing about early detection is the earlier we find cancer, the more likely we are to cure it. The earlier we find cancer, the less intensive therapy you'll need if you are diagnosed with cancer. So I think that in itself is the message that we want to get across.